ఓకే. ఇక్కడ లైవ్ వస్తుంది. ఇక్కడ నుంచి లైవ్ చేసుకోవచ్చు. Good morning, everybody. Today's class is about the flexor retinaculum, intrinsic muscles of the palm, blood vessels, nerves, and applied aspect of them. The competencies which include from 12.3 to the 12.8. Yes, when you see, I think you might have come across many competencies are included here, but they are all coming in one point only. So we are covering each one. So when we are going to the first thing, it comes as objectives. What is the objectives of this class? At the end of today's lecture, the student should be able to identify and describe the attachment of the flexor retinaculum and identify and describe the intrinsic muscles with their origin, insertion and action. Should be able to describe the formation of the arches, superficial and deep palmar arch. And last but not least, students should be able to identify and describe the course of the nerve with their anatomical basis, that is applied part. So this would be our objectives. Now, coming to our competency, now first competency which comes as 12.3 and 12.4, where it is a flexor retinaculum. Yes, what is a flexor retinaculum? The definition goes in this way. It is a thickening of the deep fascia. So this is what you are seeing. It is the deep fascia of the forearm is thickened at the part of the wrist, and forms as a retinaculum, which is called as a flexor retinaculum, and which is converting the carpal. That is what we are seeing is, because beneath this you are seeing the carpal. So there will be the carpal bones converting the carpal groove into the tunnel. So this would be the carpal bones which will be arranged. So hold that carpal groove by means of the flexor retinaculum, which is a thickening of the deep fascia. It is converted, this groove which would be small, it will be converted as a tunnel by means of the flexor retinaculum. When you see the attachment of the flexor retinaculum, medial and lateral attachment. So this is the medial side and this would be the lateral side of the palm. So when you are seeing it, medially it is attached to the carpal bones, pisiform bone and hook of the hamate. Laterally, the flexor retinaculum is attached to the tubercle of the scaphoid bone. This is a scaphoid bone, tubercle of the scaphoid and crest of the trapezium. So if you have seen here pisiform, hamate, scaphoid, trapezium, these are all the carpal bones which are present at the wrist joint. So the flexor retinaculum, which is a thickening of the deep fascia, medially and laterally, it is attached to pisiform and hook of the hamate medially, laterally to the tubercle of the scaphoid and crest of the trapezium. So by means of the flexor retinaculum, whole of your carpal groove is converted into the tunnel. So when there is a tunnel, normally whatever you see it, when there is a bridge, some things go below that one, some things go above that of your bridge. So here also, through the tunnel, you need to see what are the structures passing through and through the tunnel, what are the structures which are passing above the flexor retinaculum. But before going to that one, you need to see the extension of the flexor retinaculum. What you have come across, first thing, you have seen just now the attachment of the flexor retinaculum, the thickening of the deep fascia at the wrist. Medially, it is attached to that of the pisiform and the hamate, trapezium, and that of the tubercle of the scaphoid, it is attached. But when you see the extension of the proximal and the distal, proximally it will be continuing with the fascia of the forearm. So this here you will be getting the flexor retinaculum. So proximally it continues with the fascia of your forearm. And when you see the distally it is continuous with that of your aponeurosis of the palm. There is one aponeurosis next because it is a continuation. You can come across the palmar aponeurosis. Distally, the flexor retinaculum continues with the palmar aponeurosis which is present in the palm. So this is the extension medial, lateral, proximal and distal. Proximally, it is to the continuation of the of your fascia which is present in the forearm. Distally, there is aponeurosis in the palm which is called as the palmar aponeurosis. So your flexor retinaculum is present at this part. So we have told about the medial attachment, lateral attachment, proximal and distal. Now when you see the flexor retinaculum, the flexor retinaculum consists of two slips. There is a superficial slip which is attached to the pisiform bone. There is a deep slip which is attached to the top here crest of the trapezium. So this is a superficial slip of the flexor retinaculum. This is the deep slip of the flexor retinaculum. When you see the structures, as we have said, when there is a tunnel, so or a groove, you need to understand there are some structures which are passing through and through it. There are some structures which are passing above the top, the tunnel. So when you are seeing it above the flexor retinaculum, superficially, what are the structures which are passing? So these vessels, what you are seeing is ulnar nerve along with the ulnar artery. Next, palmar cutaneous branch of the median nerve, cutaneous branch of the ulnar nerve, and there is one tendon which is called as palmaris longus tendon. So these are the things which are passing above the flexor retinaculum. So there are some structures which are passing above and some are structures which are passing beneath. So the structures which are passing from medial to lateral side, if you see, ulnar nerve along with the ulnar artery, cutaneous branch of superficial cutaneous branch of the median nerve. Next, the cutaneous branch of the top of ulnar nerve, palmar cutaneous branch of ulnar nerve. Along with there is a tendon, that is a muscle, palmaris longus muscle. They pass above the flexor retinaculum. Next, when you are seeing the structures which are passing beneath the flexor retinaculum. So this is a cross section. So this is the flexor retinaculum, what you are seeing it. This is attached medially to the pisiform bone, laterally to the top of the tubercle of the scaphoid, and the top, the hook of the top of your hamate we are seeing it, pisiform and the hook of the hamate. So this is the flexor retinaculum, what you are seeing it. So the structures passing beneath the flexor retinaculum are above it is flexor digitorum superficialis, beneath flexor digitorum profundus, along with the top of the flexor pollicis longus, and in a separate compartment flexor carpi radialis longus tendon, along with the nerve, that is the median nerve. So these are all the things which are passing through the top of the or beneath the flexor retinaculum. Through the tunnel you can see, or you can also say this is the flexor retinaculum, beneath the flexor retinaculum. From medial to lateral side, it is flexor digitorum superficialis, flexor digitorum profundus, flexor pollicis longus, flexor carpi radialis longus, and last but not the least is that of the median nerve. So these are the structures which are passing beneath the flexor retinaculum. Yes, up till now we have seen what is a retinaculum, which is a thickening of deep fascia. Next, we have seen the attachment of the flexor retinaculum, medial attachment and the lateral attachment, medial and the lateral attachment. Then we have seen about the structures which are passing above the flexor, which are passing beneath the flexor retinaculum. Yes, after that, this is a slide which is showing the clinical importance, means the applied aspect of the flexor retinaculum. As we have said, through the flexor retinaculum, means beneath the flexor retinaculum, there is a nerve which is called as a median nerve. When you see the applied aspect, the median nerve might be compressed at the part of the flexor retinaculum. So this is the compression. It might have compressed at the part of flexor retinaculum, resulting in when there is a compression, it results in the numbness or pain along the distribution of the median nerve. Means what are the distribution? 3.5 fingers of the median of the palm is supplied by means of the median nerve. We will be seeing it, but there is a distribution at that part. There will be numbness and pain when the median nerve is compressed at that part. So, when the median nerve is compressed at the part of flexor retinaculum, the person may come across the symptoms of numbness and the pain. Okay, but how can you diagnose it? When there is compression of the median nerve, mainly because the median nerve supplies to the thenar muscles. So, see, thenar muscle, the recurrent branch will be supplying to the thenar muscle. As there is the compression, the supply is lost. So there is a atrophy of the thenar muscle. So there will be no thenar eminence as such. What you are seeing, this eminence is not present. There is a atrophy of the thenar muscles, which is by which we can understand that at the flexor retinaculum, median nerve compression has occurred. The causes of this for the compression of the median nerve may vary. It might be because of the pressure of the nerve, or it might be because of the swelling of the flexor tendons which are surrounded by the synovial sheath, because all the tendons which are coming along with the median nerve, that is flexor digitorum superficialis or flexor digitorum profundus, are surrounded by the synovial sheath. So, if there is any tenosynovitis or inflammation of that tendon, it can cause compression of your median nerve, pressure on the nerve, leading to that of the numbness and pain around that of the median nerve distribution. The reason might be because of tenosynovitis, or it might be pressure on the nerve or compression of the nerve, or it might be the joint dislocation, that is mainly a carpal bone, that is a lunate bone dislocation, or fractures, or because of osteoarthritis, or because of posture when we are keeping the wrist bent for long periods, or repetitive wrist movements, and because of that also you can see the median nerve will be compressed. Other than that, other causes, other than anatomical causes, when you see the other clinical causes, it might be because of fluid retention or any thyroid abnormalities. In case of rheumatoid arthritis and diabetes mellitus also, you can come across the median nerve would compress at that of the flexor retinaculum, leading to the atrophy of the thenar muscle, which causes pain and numbness around that of the median nerve distribution. Yes, this is about that of the flexor retinaculum, the structures passing above and below with its applied part. The next competency is the muscles of the palm. So what are these muscles? The muscles of the palm are all called as intrinsic muscles because they all take origin in the palm and also insert in that of the palm. So they are called as intrinsic muscles of the palm. So when you come across these muscles, first here before going to it, there is an aponeurosis here which is called as palmar aponeurosis. So when you are doing the dissection, the first thing is before going to the intrinsic, there is a aponeurosis that come across here which is called as palmar aponeurosis. This palmar aponeurosis is a degenerative, morphologically it is a degenerated tendon of insertion of palmaris longus tendon. If you have seen, I have said the structures passing beneath the flexor retinaculum. I have said one tendon which passes beneath the flexor retinaculum is palmaris longus tendon. Yes, this palmaris longus tendon which was passing beneath the flexor retinaculum coming at the palm forms an aponeurosis which is called as palmar aponeurosis, which is a thickening of the deep fascia. Here it is called thickening of the deep fascia in the palm forms as a palmar aponeurosis. Morphologically, it is a degenerated tendon of insertion of palmaris longus tendon. If you go in depth of palmar aponeurosis, this palmar aponeurosis consists of three parts: central, medial and lateral parts. So this is the central part of the palmar aponeurosis. This is the medial part of palmar aponeurosis. This is the lateral part of the palmar aponeurosis. When you see the central part of the palmar aponeurosis is very thick, where unlike the medial and lateral part of the palmar aponeurosis. When you see the central part of palmar aponeurosis is triangular in shape with apex facing towards the flexor reticulum and base towards the crease, palmar crease it is present. So the apex of the palmar aponeurosis continues as the tendon of palmaris longus. So that only we have said this palmar aponeurosis morphologically it is a degenerated tendon of palmaris longus. So this is a palmaris longus tendon coming here. It is forming as aponeurosis which is called as palmar aponeurosis. The central part of the palmar aponeurosis is triangular in shape with apex continuing with the tendon of palmaris longus and base is fanned, means it is wide, you can see it dividing into the top here two slips, superficial slip and the deep slip. Here you can see there is a superficial slip and there is a deep slip of the base. The superficial slip of the base formed as it merges with that of a superficial transverse palmar ligament and deep merges with the deep transverse palmar ligament with that of your metacarpal joints, but it merges with the deep transverse metacarpal ligament. So it consists of superficial and the deep slip. When you see at the base, yes, the base is wide. This is wide, consisting of two slips. Superficial, this is a superficial and it is a deep. Same way, if you come across here, this is a superficial transverse metacarpal ligament. The superficial slip continues with the superficial fascia of the dermis and forms as a superficial transverse metacarpal ligament. So here you can see the superficial and the deep slip of the base of the palmar aponeurosis. So between the superficial and deep there is a gap through which the vessels and nerves along with the tendons pass through. So if you can see here between the superficial and deep slip you can come across the vessels and the nerves which are passing between the superficial and deep slip of the base of the palmar aponeurosis. Yes. This is about the central part of the palmar aponeurosis. After the central parts, when we see there is other part of the palmar which is the medial and the lateral part. The lateral part of the palmar aponeurosis is attached to the first metacarpal. So this is the first metacarpal, it is attached. Whereas the medial part of the palmar aponeurosis is attached to the fifth metacarpal. So it is here, it is attaching to the fifth. Here it is attaching to the first metacarpal. By this attachment, whole of the palm is divided into compartments. It is called as a of your potential spaces. This is called as a thenar. This is called as hypothenar, and this is called as mid-palmar spaces, which are very important spaces. So the medial and lateral part are the spaces these are the things which subdivide the palm into some potential spaces like thenar space, hypothenar space and the mid-palmar space. So this is about the palmar aponeurosis. When you see the functions of the palmar aponeurosis, what is this palmar aponeurosis, which is a degenerated incision of the palmaris longus tendon? What its function is? The palmar aponeurosis provides firm attachment to the overlying skin to improve the grip. Means it is helpful for improving the grip. Whatever things you are catching, the grip is aided by means of palmar aponeurosis. The second function is it protects, because we have seen between the superficial and deep slip of palmar aponeurosis, there are some vessels and nerves which are passing through. So whenever you are doing any of your functions like flexion, extension, the protection is given to the palmar vessels and nerves. Yes, already you knew it provides origin to a subcutaneous muscle that is called as palmaris brevis. In the later part of the slide, you will be coming across what is this muscle. And next, it prevents, the most important thing is, when we have seen the palmar aponeurosis protects, because through the superficial and deep slit there are some tendons which are passing. So it prevents the bowstringing of the flexor tendons. And the important thing, yes, whole of the, when you have seen the medial and the lateral septa of the palmar aponeurosis, which divide the palm into most important potential spaces, which are surgically important as thenar space, mid palmar space, hypothenar space. So you will be coming across in the later classes what are these spaces, what are the surgical importance of that. Yes, mostly the palmar aponeurosis, that is medial and lateral septum of the palmar aponeurosis, is responsible for the division of the palm into these spaces. Yes, this is about the palmar aponeurosis. You need to say, you have to know what is palmar aponeurosis. It is a thickening of the deep fascia, degenerated tendon of palmaris longus. When you see the proximal and distal part, proximally it is continuation of the palmaris longus tendon. Distally, so this is a proximally, it is a continuation of palmaris longus tendon. Distally at the palmar crease, it is divided into superficial and deep. So this is what it is dividing. It is triangular. It is divided into superficial and deep slit. Between these, the vessels, nerves and tendons will be passing. So this central part of the palmar aponeurosis protects these vessels and nerves from the bowstrings, and it divides, when you see the medial and lateral septa, it divides whole of the palm into some potential spaces. Yes, the clinical part of the palmar aponeurosis. Any inflammation of the palmar aponeurosis cause a contracture which is called as Dupuytren's contracture. It is the inflammation of the palmar aponeurosis. So when the palmar aponeurosis is inflamed, yes, this is a palmar aponeurosis. When it is inflamed, this becomes thickened. So this becomes thickened. The mostly the affected part is the proximal and middle phalanges are flexed in this contracture. The proximal and that of your middle, whereas a distal. So this, when you are seeing is, this is a proximal, this is the middle, and this is the distal phalanges. So in the Dupuytren's contracture means when the palmar aponeurosis is thickened or inflamed, yes, at that part the proximal and the middle phalanges are thickened and it forms the flexed, whereas the distal phalanges is not involved when there is inflammation of the palmar aponeurosis. So this contracture where only the middle and the proximal phalanx are involved, this type of contracture is called as Dupuytren's contracture. It is because of thickening of the palmar aponeurosis or inflammation of the palmar aponeurosis results into this contracture. Yes, so after removing of the palmar aponeurosis, yes, now we are in the muscles of the hand, that is intrinsic muscles of the hand. They take origin within the palm and insert within the palm. So these are called as intrinsic muscles. So they divided into four groups: thenar muscles, hypothenar muscles, lumbricals, between the lumbricals interossei, that is palmar and the dorsal interossei. So we'll be going in detail the each group. Yes. By now I think you understand what is a thenar eminence, what is a hypothenar eminence. Yes, when you are coming to see here, so these group here, the muscles are called as thenar muscles. The muscles which are present at this part, at the little finger, is called as hypothenar muscles. So this is a thenar group of muscles at the thumb part. At the little finger part, these are called as hypothenar muscles. Between this, what you will be seeing here at this part, you will be coming across the lumbricals, and at between that of the metacarpals, you will be coming across at the palm, palmar interossei, at the dorsal part, dorsal interossei, you will be coming across. So when you come across each one, first, the thenar muscles are the thenar eminence. What this is called as thenar eminence. The thenar eminence, when you see the introduction part, it consists of three muscles. These are flexor, abductor and opposition. That is flexor group of muscles, abductor group of muscles and opposition group of muscles. All the three thenar muscles, all these three thenars, they take origin from the carpals and the metacarpals. Insertion is also because as we have said these are intrinsic muscle, they take origin and insertion is within the palm only. So origin is from the carpals and metacarpals, insertion is into first metacarpal and the phalanges. Same way when you come across the hypothenar, they also include the three muscles where the origin and insertion is again the same carpals and metacarpals with insertion as first metacarpal and the phalanges. Yes, when you see in detail the muscle, first coming to the muscles which are forming the thenar eminence. So these are the three thenar muscles, that is flexor pollicis brevis, abductor pollicis brevis and opponens pollicis brevis. So as if you come across here flexor pollicis, abductor pollicis, opposition pollicis brevis. So these are the three muscles which you are coming across and they are forming the thenar eminence. When you see the origin, whenever we have said the muscle, so we should talk about the origin, insertion, action and the nerve supply. Yes, when you see the thenar muscles, the flexor pollicis brevis, the origin as we have said, the origin of all the thenar muscles, they take origin from the carpals and metacarpals. Yes, when you are seeing here, flexor pollicis brevis, opponens pollicis and abductor pollicis. The origin is the common origin flexor retinaculum as we have studied just now what is the retinaculum and from the carpal bones. Yes, from flexor retinaculum and the carpal bones the origin is from the same. When if you come across abductor, flexor or opponens pollicis, insertion is into the base of the proximal phalanx and that of the metacarpal. When you see the action, it is abductor pollicis means it does abduction of the thumb. Flexor pollicis, it does flexion of the thumb. Opponens pollicis, it does the opponens action of your thumb. So this is the action of the thenar muscles, abductors, flexors and opposition action. Yes, other than these three, abductor pollicis, flexor pollicis and opponens pollicis, the thenar eminence also include one more muscle which is called as adductor pollicis. So this is what is called as adductor pollicis. The action is adduction. But the adductor pollicis consists of two heads. There is a transverse head of adductor pollicis. There is a oblique head of adductor pollicis. The transverse head of adductor pollicis origin is from the third metacarpal. So this is what we are seeing. Whereas the oblique head arises from the base of first and second along with that of the carpal bones. Insert in that of the proximal phalanx of the thumb. So there is one more muscle which is called as that of the adductor pollicis. Yes, when you see the nerve supply of the thenar group muscles, abductor pollicis, flexor pollicis, opponens pollicis is supplied by the median nerve, but unlike adductor pollicis is supplied by the ulnar nerve. This anyhow in the last part of our class, you will be seeing the nerve supply. There you will be coming across why. But do remember, yes, all the muscles, flexor, opponens and the of your abductor, they are supplied by median nerve. Unlike adductor pollicis is supplied by means of the ulnar nerve. So this is the how the three thenar muscles which are forming the thenar eminence. Next, the hypothenar eminence or hypothenar muscles include flexor digiti minimi brevis, abductor digiti minimi and opponens digiti minimi. So these three form the hypothenar eminence. So when you see the origin and insertion of these three, it is again the same. They are taking origin from that of the carpus. Insertion is into that of the phalanx. Origin is from the carpus, and you can see it. It is from the pisiform bone, hamate and the flexor retinaculum. Even opponents is same. Insertion, it is into the proximal phalanx and the top of your metacarpal. When you see the action, abductor, so it does the action is abduction of the little finger. Flexor, flexion of the little finger. Opponents, it is the opponent's action of the little finger. So the name, according to the name, the action goes on. So these are the three: abductor, flexor and opponents. But all these three hypothenar muscles are supplied by means of the ulnar nerve. So here the thenar muscles are supplied by the median nerve. Yes, whereas the hypothenar muscles are supplied by means of the ulnar nerve. Yes, because ulna is at this side, there is an ulna bone over this side. This is a radial side. Radial side is supplied by the thumb at the thumb, which is called as thenar. It is supplied by the median nerve, except adductor pollicis. The ulnar side, it is supplied by means of medially. It is supplied by means of the ulnar nerve. Yes. Same way in the as such we have seen in the thenar eminence, adductor pollicis. Here also there is one more subcutaneous muscle in the hypothenar eminence, which is called as palmaris brevis muscle. So this palmaris brevis is a subcutaneous muscle which is a remnant of panniculus caronosus, which forms the facial muscles, but it is the subcutaneous striated muscle. What you are seeing at the thenar, at the proximal part of the hypothenar eminence. At the proximal part of the hypothenar eminence, you come across a small striated muscle which is called as that of palmaris brevis. So this is the short muscle which is called as palmaris brevis. Taking origin is from the flexor retinaculum. Insertion is into the medial border of the ulna. So the origin is from the flexor retinaculum. Insertion is into the medial border of the ulna. So this is a small subcutaneous muscle which is present at the hypothenar eminence. Yes. So up till now in the intrinsic muscles, we are finished with the thenar muscles, hypothenar muscles. Next, let's see the lumbricals. Yes, what are these lumbricals? The lumbricals are, when you are seeing it, the lumbricals are the thin earthworm shaped, small earthworm shaped muscles. When you are seeing it, as the name indicates, they are earthworm. Earlier in the 12th, I think you have come across as a lumbricoids. So these are called as lumbricals. So their shape is in the form as an earthworm. So these are called as adopted lumbricals. In palm, there are about 4 lumbricals are present. So this is the first, second and third, fourth from lateral to medial side. When you see from lateral side, the first and second lumbricals are unipinnate lumbricals, whereas third and fourth are the bipinnate lumbricals. Next, any muscle, because lumbricals also are the muscles, but they are thin earthworm shaped muscles which are present, and the name comes in because they are in the shape of that one. The origin is, you need to see the origin insertion also. So the origin of these lumbrical is, so this tendon what you are seeing here is flexor digitorum profundus tendon. I think you up till now you have come across in the arm the muscle, superficial group, deep group of muscle. I think you might come across flexor digitorum superficialis, flexor digitorum profundus, palmaris longus tendon, pronata teres. All this you might have come across. In that, in the deep group, there is a muscle that is called as flexor digitorum profundus, which is a deep group muscle. From the lateral or the radial side of flexor digitorum profundus, you can see this earthworm shaped muscle taking origin from the lateral or the radial side of the flexor digitorum. So this is flexor digitorum profundus. From the flexor digitorum profundus, from the lateral side you can see the first lumbrical, second, third and the fourth lumbricals which are coming from the radial side of flexor digitorum profundus. So this is the origin. When you see the insertion of the each lumbricals, so these are the lumbricals which are coming from the flexor digitorum, from the radial side of the flexor digitorum profundus, they are coming. But the insertion is, they are going up to the top here from palmar to that of the dorsal part, they are coming up to that of the middle and that of the distal phalanx. See, from here they are extending up to the top of the dorsal surface, up to the top of the middle and the distal phalanx, forming as a dorsal digital expansion, and then they are inserting. As they are linking the palmar surface with the dorsal surface, means they are linking the palmar surface is connected to the dorsal surface by means of these lumbricals, because they are coming from the palm but getting inserted from the dorsal surface of the top of your palm to that of the middle and the distal phalanx, forming as a dorsal digital expansion, and then they are inserting. So these muscles are called as link muscles, because they are linking the palmar aspect of the palm to that of the dorsal aspect. So these muscles, the main important function of these muscles are whenever you are doing as a stroking movements. So when you are playing any instruments, that stroking movements, or when you are doing the fine movements like handwriting. So all these are done because of these lumbricals which are present, which are coming from the top of the radial side of flexor digitorum profundus. So when you see it, they flex, the action is they flex that of the second to fifth metacarpal phalangeal joints. At the metacarpals, they does the flexion at the metacarpals, and they does extension at the interphalangeal joints, because the origin is from here, the insertion is. So at the insertion part, the function is extension. At the origin part, they flex from second to fifth finger. The flexion is done by means of the top of your lumbricals, and the extension at the interphalangeal joint is by means of the top of your insertion, which is going, means they are coming from the palmar aspect, inserting into the dorsal aspect, middle and the distal phalanx. Yes. The one more muscles, intrinsic muscles, are palmar interossei and dorsal interossei muscles. There are 4 palmar and 4 dorsal interossei muscles. So when you see each interossei, first coming to the 4 palmar interossei muscle. The first palmar interossei muscle, it takes origin. So this is the palmar interossei muscle. It takes origin from the top, the ulnar side of the first metacarpal bone. Second, the first and second is coming from the ulnar side of the first and second. So these are the metacarpal bones and these are the phalanges. So the first and the second palmar interossei, they are coming from the ulnar side. This is ulnar, this is the radial side. So they are coming from the ulnar side of the first metacarpal bone, inserting into the proximal phalanx. Same way, when you come across third and fourth palmar interossei, they come from the top of the respective third and fourth metacarpal and inserting into the proximal phalanx. So in this way, all the 4 palmar interossei, they are coming from the top of the metacarpals and inserting into the proximal phalanx. When you see the dorsal interossei muscle, so this is the dorsal interossei muscles. These are present between the spaces between the 2 metacarpals. If you are seeing here, these are the metacarpal bones. So these are the metacarpal bones. The space between the 2 metacarpals is joined. The muscle we are seeing here is the dorsal interossei muscle. So these are the dorsal interossei muscle which are coming between the top of the 2 metacarpal bones. So these are coming from the top of the all the top of your metacarpal bones and inserting into the top of the proximal side, proximal phalanx, radial and the ulnar side of the top of the proximal phalanx. These are 4 dorsal interossei. When you see the action of these intrinsic, means palmar and the dorsal interossei muscle, the palmar interossei muscle is helpful. This is the axis. This part, this finger, what you are seeing is the axis. Here, what you are seeing, this is the axis of the. So along this axis, it does the adduction. adduction. So palmar interossei does adduction, whereas the dorsal interossei does abduction of the fingers. So when you see the how you can remember is pat, that is palmar interossei, these are the adductors of the fingers, whereas dorsal interossei are abductors of the fingers. Dorsal interossei are abductors, whereas palmar interossei are adductors of the fingers. Yes. So that are all that of the intrinsic muscles where you have seen the thenar muscles, hypothenar muscles, four lumbricals, four palmar interossei and four dorsal interossei. Next, coming to that of the blood vessels of the palm. So what are the blood vessels of the palm? The vessels in the palm form an anastomosis in the palm. This is called as superficial and deep palmar arch. The superficial palmar arch is formed by, so here it is the superficial palmar arch what we are seeing it. This arch is formed on the ulnar side you come across the ulnar artery, on the radial side you will come across a radial artery. Yes, the branch of the superficial terminal branch of ulnar artery on the medial side, anastomosis with that of the on the laterally the superficial palmar branch of the radial artery. It might be the superficial terminal palmar branch of the radial artery or arteria princeps pollicis or arteria radialis indicis or arteria nervi mediana. Means the arch can be completed. Medially it is constant. The artery here is ulnar artery, but the superficial branch, superficial terminal branch of ulnar artery. This is ulnar artery. The superficial terminal branch of ulnar artery on the medial side. It anastomosis with or it joins with the lateral side either with the superficial branch, palmar branch of the radial artery or the branch which is going to the pollicis, arteria radialis pollicis or arteria radialis indicis or the artery which is coming along with nerve which is called as arteria nervi mediana. So this arch can be completed on the lateral side either with joining with the superficial branch of the radial, that is superficial palmar branch of the radial, or by the branch which is going to that of your princeps pollicis or with that of your radialis indicis or the branch which is coming with that of your nerve arteria nervi mediana. So that is why we have written the medial is constant, that is superficial branch of terminal branch of ulnar artery laterally joins with either with superficial palmar branch of radial or arteria princeps pollicis which is supplying to the top of your pollicis finger or the thumb or arteria radialis indicis, the branch which is towards the index finger, or there is a nerve which is accompanied by an artery which is called as arteria nervi mediana. So laterally the superficial palmar arch can be completed with joining with any of these branches of the radial artery. So any of these branches, if the superficial branch of the terminal branch of ulnar artery can join with any of these branches of the radial artery and can complete the arch which is called as superficial palmar arch. Now coming to the branches, when you see the this one, yes, this is that of your arch what you are seeing it. The convexity, from the convexity of the arch, superficial palmar arch, you come across it is giving some branches. So these are the four palmar, the convexity of the superficial palmar arch gives four palmar digital arteries. So this is 1, 2, 3 and 4 palmar digital arteries. The digital artery which is towards the medial side of the ulna passes along the top of the ulnar side of the little finger. So it is passing along the ulnar side of the little finger. That is the first palmar digital artery. The rest three palmar digital arteries continues as three common palmar digital arteries. So here they are continuous as the three common palmar digital arteries 1, 2 and 3, dividing into two proper palmar digital arteries which is supplying to the adjacent side of the fingers. Means from the convexity of the arch, the first one is 4 palmar digital arteries you are getting. The first palmar digital artery passes along the ulnar side of the little finger as applies there, whereas the other 3 palmar digital arteries continues as common palmar digital arteries and divide between the adjacent fingers as proper palmar digital arteries supplying to the adjacent side of the fingers. This is about the superficial palmar arch. When you see the flow chart of the superficial, yes, the convexity of the palmar arch, what we are getting is a 4 palmar. That 4 palmar digital arteries gives 3 common palmar digital. From that, each common palmar digital artery is giving 2 proper palmar digital arteries supplying to the adjacent side of the fingers. This is about the superficial palmar arch. Next is a deep palmar arch. The deep palmar arch lies in the concavity of within the concavity of this arch is the deep branch of the ulnar nerve is present, but the deep palmar arch is formed by, earlier we have seen, the superficial is formed by the superficial branch of the ulnar joining with any of the branches of the radial artery. Means superficial terminal branch of radial or the branch of the pollicis or the index, and the arch is completed. But when you are seeing the deep palmar arch, after removing the superficial, what you come across in the palm is one more arch is present, which is called as deep palmar arch. The deep palmar arch is formed by the deep branch of the ulnar artery, the deep branch of ulnar artery anastomosis with the terminal branch of the radial artery. Yes, when you are seeing it, the deep branch of ulnar artery anastomosis with the terminal branch of the radial artery. This is a radial artery what you are seeing. In that way, the deep palmar arch is completed. When you are seeing the radial artery, this is a radial artery. The radial artery in the palm, it comes from piercing the dorsal part, from the dorsal interossei. They pierce the dorsal interossei, enter into the palmar aspect of the palm between the two heads of the adductor pollicis, that is transverse and the oblique head of the adductor pollicis. The radial artery goes behind, then comes in front of the palm, and they complete the arch by anastomosing with the deep branch of the ulnar artery. So when you are seeing it, so this is the radial, this is the deep palmar arch what you are seeing it. This deep palmar arch, when you are seeing it, one thing when you have understood or not, if you have seen the superficial palmar arch, the superficial palmar arch, the branches of the superficial palmar arch, the proper palmar digital artery is applied to the ulnar side of the little finger. The 3 common palmar digital arteries, which are dividing into 2 proper palmar digital arteries, are supplying to either side of the little finger and the middle finger. Next, the second, the proper palmar, common palmar, which is dividing into proper, it is supplying to adjacent side of your middle finger and the index finger. Next, to the index finger, to that of the middle, and that of the index finger, adjacent side of the middle and to that of the index finger, it is supplied. But when you see, the superficial palmar arch is deficient in supplying to the either side of the thumb, adjacent side of the thumb, and the radial side of the index finger. Means the superficial palmar arch is supplying only to the top, the 3½ fingers. It is supplying 1, 2, 3½ it is supplying, but the last, the 1½ part is compensated by means of the deep palmar arch. So how it is done? Yes, by now I think you have understood the deep palmar arch formation. Superficially is formed by the superficial branch of the ulnar artery along with the superficial terminal branch of the radial. Okay, it is forming either with any of the of your arteries, as we have discussed, the radial arteries which are with any of these things it can anastomose and form an arch. But when you come across the deep palmar arch, the deep is forming on the of your medial side with the deep branch of the of your ulnar joining and anastomosing with the top of the radial artery. Means in this way, see here, this is a radial artery which is, there is a terminal branch of the radial artery and it is forming the deep palmar arch. Yes, when you see the branches of the deep palmar arch, so when you have come across here, this is giving, you can see here the branches to the pollicis, princeps pollicis and to the radialis indicis. So this is what your deep palmar arch, what the superficial palmar arch was not supplying to the palm. Yes, this deep palmar arch is supplying to the either side of the thumb by means of the top here princeps pollicis artery and radialis indicis artery. The terminal branch of the radial artery which is giving these branches is supplying to the either side of the thumb and the radial side of the index finger and completing the arch. The convexity, from the convexity of the arch, the branches you are coming to see is 3 palmar metacarpal arteries. So these are the 3 palmar metacarpal arteries which join with the palmar digital arteries of the superficial palmar arch. Same way, from other than that, these are also giving some 3 perforating branches which again join with or anastomose with dorsal metacarpal arteries of the dorsal carpal arch. Other than that, it also gives recurrent branches. Yes, I think why superficial and deep palmar arch, I think you might have understood. The superficial by the vascularity, this is a vascular supply, means blood supply. So the blood supply of the superficial palmar arch, it is supplying to that of your 3½ fingers from medial to lateral side. It is supplying only up to this part from medial to lateral. Where the deep palmar arch is compensating the one that is not supplied by the superficial is done, and the arch is completed by anastomosing with the deep branch of the top of the radial artery. So this is about the deep palmar arch. Yes. Next, the nerves of the palm. Yes. The first nerve that you come across in the palm is the median nerve, which is called as a Leberer's nerve. Leberer's nerve, yes, you knew why it is Leberer's. Yes, it does many function as labor it does. So this is called as that of the median nerve. The normal name for it is also called as a Leberer's nerve. First, when you come across the median nerve, when you see the course of the top of your median nerve from brachial plexus, if you see it, the root value of the median nerve is C5, C6, C7, C8 and D1. It is called as median because it runs in the forearm in the median plane, so it is called as a median nerve. But how the median nerve is formed? The lateral cord of the lateral root from the lateral cord of the brachial plexus and the medial root from the medial cord of the of your brachial plexus, they join and to form as that of the median nerve. So this is a lateral root of the brachial plexus. This is the medial root. Lateral root and the medial root both join to form as the median nerve. So that is the formation of the top of your median nerve. The lateral root from the lateral cord, medial root from the medial cord. If you come across here, yes, the lateral root which is coming from the lateral cord of the brachial plexus, the medial root which is coming from the medial cord of the brachial plexus, both join and forms as a median nerve. In the arm, the median nerve at first lies lateral to that of the brachial artery, means axillary artery. After that it is brachial artery. Yes, it lies lateral to that of the brachial artery in the arm. From the arm, at the piercing of the coracobrachialis muscle, where coracobrachialis is pierced, it crosses from lateral to medial side. Now lies it from the medial side of the of your, crossing from lateral to medial side and lying medial to the of your brachial artery. Now it is entering into the top of the cubital fossa. From the cubital fossa, it is entered into the forearm between the two heads of the of your pronata teres and between the two heads of flexor digitorum superficialis In the forearm, it lies between the superficial and deep group of muscle, that is between the flexor digitorum superficialis and between flexor digitorum profundus. This is flexor digitorum superficialis, this is flexor digitorum profundus. Between superficialis and the profundus, the median nerve will be present in that way. So the median nerve will be sandwiched superficially by means of superficial flexor digitorum superficialis and below by means of the profundus. So in the forearm it is in that way. So coming at the part of flexor retinaculum, the median nerve comes laterally at this part of the flexor retinaculum. It lies between the palmaris longus and flexor carpi radialis longus tendon, passes beneath the flexor retinaculum and enters the palm. Yes. So in the middle, about 5 centimeters, when it enters the forearm between the two heads of pronata teres, then it lies between the flexor digitorum superficialis and flexor digitorum profundus. After that, it goes laterally, lies between the palmaris longus and flexor carpi radialis tendon, passes beneath that of the flexor retinaculum, and it has entered into the palm. So our course should start from here only. So when it has entered beneath the flexor retinaculum, the median nerve enters beneath the flexor retinaculum. This, I think you know, when we have started the class also, I have said the structures passing beneath the flexor retinaculum is median nerve. Yes, the median nerve has entered into the palm beneath the flexor retinaculum. When you see the course of the median nerve in the palm, after entering into the palm, soon it gives one branch which is called as recurrent branch. This recurrent branch of the median nerve supplies to these three thenar muscles, as we have known earlier: abductor pollicis, flexor pollicis brevis, and opponens pollicis. Abductor pollicis, flexor pollicis, and opponens pollicis. So the recurrent branch of median nerve supplies to these three group muscles, that is these three thenar group muscle. After giving the recurrent branch, the median nerve will be dividing into lateral branch and the medial branch. After giving the recurrent branch, the median nerve in the palm is divided into lateral and the medial branch. Let's see each branches in detail. First, the lateral branch. So this is the median nerve. First, we have a orientation. This is the median nerve. It has entered beneath the flexor retinaculum, given a recurrent branch to the top of the thenar muscles, dividing into lateral and the medial. The lateral branch gives three proper palmar digital nerves. The lateral branch of the median nerve is giving 1, 2 and 3 proper palmar digital nerves. The three proper palmar digital nerve supplies to the either side. The first two supply to the either side of the thumb and the radial side of the index finger, along with one lumbrical. If you knew, I think now you can have an idea what is lumbrical. That is an intrinsic muscle, earthworm shaped muscles. So it gives one supply to the top of your lumbrical also. The lateral branch of median nerve, which has divided into lateral and medial, it gives three proper palmar digital nerves. These three proper palmar digital nerves supplies to the adjacent side of the thumb and the radial side of the index finger. The branch which is supplying to the radial side of the index finger supplies to the first lumbrical. Yes, you can see here. This is the lateral branch of the median nerve which is supplying to the either side of the thumb, and it is supplying to the radial side which is giving nerve to the top of the branch to the first lumbrical. So this is about the lateral branch of the median nerve. So we have done with this branch. So we have said the median nerve should passing through the flexor retinaculum, enter the palm, given a recurrent branch, divided into two, that is lateral and the medial branch. Now let's see what is the medial branch. We have up till now we have seen the lateral branch. Yes, The lateral branch, the story is this is the lateral branch of the medial nerve, this is the medial branch. The lateral branch giving three proper digital nerve which is supplying to either side of the thumb, radial side of the index finger and one lumbrical. Yes, that is over. Now coming to the medial branch. Yes, so this is the medial branch of the median nerve. This is the medial branch of the median nerve. You come across, this is the medial whole is the median nerve. This is the lateral branch where we have finished giving three branches. Yes, that part is over. Next we have said there is one more branch which is called as a medial branch. So let's see the course of the medial branch. The medial branch is dividing into common palmar, lateral common palmar and medial common palmar digital nerves. So this is the medial branch giving lateral common palmar digital and medial common palmar digital nerves. These are proper palmar digital nerves, but the medial branch is giving common palmar digital. This is common palmar digital nerves. The medial branch gives lateral and medial common palmar digital nerve. The lateral common palmar digital nerve supplied to the second lumbrical and adjacent side of the index and that of the middle finger. Yes, adjacent side of the index finger and the middle finger. That is what the medial branch, lateral part, that is lateral common palmar digital nerve is doing. The medial common palmar digital nerve receives a communicating branch from the ulnar nerve, divides into two proper palmar digital nerve which is supplying to the adjacent side of the middle finger and to that of the index finger and to that of the ring finger. So in this way the medial nerve supplies to 3.5 fingers or 3.5 digits it is supplying. I am repeating again. Medial nerve entered, divided into lateral and the medial. First, lateral branch and the medial branch. The lateral branch has given three proper palmar. The three proper palmar, the first one and second one is supplying to either side of the thumb. The third one is supplying to the radial side of the index finger. That is about the lateral branch of the medial nerve. The medial branch of the medial nerve again dividing into lateral common palmar and medial common palmar. The lateral common palmar digital nerve supplies to second lumbrical, dividing into two proper palmar digital nerves which is supplying to the adjacent side of the index and the middle finger. Yes, the medial common palmar digital nerve receives a communicating branch from the ulnar nerve and divides into two proper palmar digital nerve which is supplying to the adjacent side of the middle and that of the ring finger. Means medial nerve has only supplied up till that of your 3.5 fingers. It is supplying. Yes. You can see at our dissection part. Yes, this is the medial nerve. Soon after, it has given a recurrent branch which is supplying to the three thenar muscles. After giving the recurrent branch, it has divided into that of a lateral and the medial. The lateral branch is giving three proper palmar digital nerves. These are the three proper palmar which is supplying to either side of the thumb and the radial side of the index finger. This is the medial common palmar digital nerves which is again dividing into lateral and the medial. The lateral is giving to second lumbrical and giving two proper palmar digital nerves. The medial one receiving a communicating branch from the ulnar nerve and again dividing into two proper palmar digital nerves. So this is the course of the medial nerve in the palm. Yes, when you see the summary, the recurrent branch of the medial nerve has supplied to three thenar muscles. The proper palmar digital nerves was supplying to two lumbricals. These are the muscles which are supplying. Next, this is motor supply of the medial nerve. Sensory supply is 3.5 digits. It is supplying to 3.5 digits, 1, 2, 3.5, up till the top of your half digit, including the skin, and also supplying the dorsal aspect up till from here to here, up till the top of your distal phalanges. Up till the distal phalanges, the median nerve cutaneous supply is present. There are also, median nerve is also giving it nerves supply for the top of your joints and to the top of your vessels, that is called as articular branches and the vascular. Yes, you can see the 3.5 sensory distribution, cutaneous distribution, palmar, and the dorsal side, distal fingers are the part, you can see it, distal phalanges, it is supplied. Yes, the applied part of the median nerve. What is the applied? The first thing, when the median nerve injury, whether it might be high, up or low, what things that can commonly happen is, yes, one is ape hand deformity. Yes, the median nerve, this is what you are seeing is ape hand deformity, thumb in adduction and extended. Yes, the web space is contracted, there is no web space. Opposition movement is lost. Yes, fingers show trophic changes because the thenar eminence is lost. The trophic changes are seen. Slight clawing of index and that of the middle fingers because median nerve is inserting to the first and second lumbrical also. These are some of the deformities of the median nerve injury. It might be in the forearm or in the flexor retinaculum. But the common thing what you can see is one, I think by now you understand what is a carpal tunnel syndrome, is compression of the median nerve when it is passing through the carpal tunnel is called as carpal tunnel syndrome, where you can see the symptoms numbness and pain along the 3.5 fingers where the median nerve is supplying. Here you can see the thenar eminence, what we are seeing, this bulge is lost, that is atrophy of the thenar eminence because the median nerve is injured. Because of that, as it is supplying to the recurrent branches, supplying to these three thenar muscles, the thenar atrophy, muscles atrophy you can come across here. The carpal tunnel syndrome, in this syndrome, when the median nerve is injured, you come across a motor, some sensory, vasomotor and tropic changes. The motor changes what you come across because the median nerve supplies to the thenar eminence. Because of that, as it is lost, the ape thumb deformity is seen because the thenar muscles and lumbricals, first and second lumbricals, these are the motor changes. Sensory is, as the median nerve is supplying to 3.5 digits, including the dorsal phalanges, there is a loss of sensation of 3.5, including the nail beds, and the distal phalanges up to the dorsum. So this is the sensory changes. Vasomotor is the skin area with the sensory loss. When you see it is warmer due to the dilatation of the arteries, and there it is also dry because of the dilatation of the arteries. That is one part. Tropic changes is, yes, dry and scaly skin you come across the median nerve, where the median nerve distribution, that is 3.5 part along the cutaneous part, you come across the skin, there is dry and scaly, that comes under a tropic changes. So in a syndrome which includes symptoms, so these are where you come across motor, sensory, vasomotor and tropic. The motor changes include ape thumb deformity, sensory, loss of sensation of 3.5, including the nail bed and the dorsum part of the distal phalanx. Sensory is lost. Vasomotor is the skin area over the sensory is lost, and it will be warmer because of the dilatation of the vessels. Tropic changes is what dry and scaly skin is seen along the distribution of the median nerve. So this is called as a carpal tunnel syndrome. So that is about the median nerve, laborer's nerve. Next nerve is the ulnar nerve, which is the musician's nerve. Yes, the ulnar nerve, it is arising from the medial cord of the brachial plexus. When you have seen the medial cord, it is coming from the lateral root of the lateral cord and the medial root of medial cord joined to form the median nerve. But ulnar nerve, it is arising from the medial cord of the brachial plexus. In axilla and in the arm, it doesn't give any branches. Passing in the midway only, passes behind the medial epicondyle. It passes behind. Medially it will be coming. Passes behind the medial epicondyle. From the arm, it enters into the forearm by passing behind the medial epicondyle. See, it is passing behind the medial epicondyle, entering into the forearm. In the forearm, it lies between the two heads of flexor carpi ulnaris. It lies between the two heads of the flexor carpi ulnaris muscle. Next, it passes, if you have seen the carpal flexor retinaculum, the ulnar nerve passes above that of the flexor retinaculum. So, this is what you are seeing, the ulnar nerve is passing above the flexor retinaculum along with the ulnar artery. So, this is how your ulnar nerve passing. It is unlike median nerve which is passing through beneath the flexor, but ulnar nerve will be passing above the flexor retinaculum, enters into the palm. But before entering into the palm, at the hypothenar epinus, where there is a small muscle, that is palmaris brevis muscle, at that part, the ulnar nerve is dividing into two branches, that is superficial branch and the deep branch. So, this is a superficial branch and the deep branch of the ulnar nerve. So, ulnar nerve, after entering superficially from the flexor and above the flexor retinaculum, enters into the palm. At the proximal part of the hypothenar epinus, this ulnar nerve divides into superficial and the deep branch. When you see each one, the superficial branch of ulnar nerve, this is a superficial branch of the ulnar nerve. It is dividing into the superficial branch. It is dividing into medial proper palmar digital nerve, which is supplying to the ulnar side of the little finger. That is one. Next, the lateral part. This is what you are seeing. The lateral common palmar digital nerve, this is a medial and this is a lateral. The lateral common palmar digital nerve supplies to the adjacent side of the little finger and to the ring finger, adjacent side of the little finger and to the ring finger. So, this is the course of the ulnar nerve, that is a superficial branch of the ulnar nerve. Superficial branch of ulnar nerve after entering divided into superficial and deep. The superficial branch of ulnar nerve is divided into medial and lateral. The medial is supplying, forming as medial proper palmar digital nerve, supplying to the ulnar side of the little finger. Whereas the lateral part forms a lateral common palmar digital nerves and supplying to the adjacent side of the little finger and to the top of the ring finger. This is what your ulnar nerve is. If you see ulnar nerve enters the palm superficially above the flexor retinaculum, divides into after entering at where is the palmaris brevis, it divides into superficial and deep branch. The superficial branch it supplies to the top of the palmaris brevis and supplies to the 1.5 finger of the ulnar side. At the ulnar side, 1.5 finger it is supplied. Medial nerve was supplied 3.5. So, ulnar nerve 1.5 it has been supplied. That is about the superficial branch of, see, this is a superficial branch of the ulnar nerve. Here it has given the branch to the palmaris brevis. Soon after it is divided to proper, which is supplying to the ulnar side. Then dividing to two, supplying to the adjacent side of the ring and that of the little finger. 1.5 finger it has supplied. The deep branch, that is about the superficial branch course. The deep branch of ulnar nerve runs along the concavity of the deep palmar arch. Earlier we have come across the deep palmar arch. It runs along the concavity of the deep palmar arch, supplying to the hypothenar muscles, third and fourth lumbrical, and the adductor pollicis, that is transverse and oblique head of adductor pollicis is supplied by the deep branch. So, deep branch is supplying hypothenar muscles, third and fourth lumbricals, palmar and dorsal interossei, along with the top the adductor oblique and transverse head of adductor pollicis is supplied by means of the ulnar nerve, that is deep branch of the ulnar nerve. So, when you see the muscular branches as we have discussed, it supplies to hypothenar, palmar and dorsal interossei, third and fourth lumbricals, adductor pollicis, it gives articular and also the vascular branches. This is the cutaneous supply, sensory supply of the ulnar nerve on the palmar aspect, and you can also come across the dorsal aspect up till what part the ulnar nerve is supplying. Yes, up till the dorsal aspect you can see the middle and the distal phalanx. Up till what part it is supplying the dorsal cutaneous branch which is supplying the ulnar nerve. So when you see the innervation of the ulnar nerve in the forearm, it is supplying to the two heads of flexor carpi ulnaris and a part of flexor digitorum profundus in the forearm. In the thenar, yes, the hypothenar muscles are all the muscles which are supplied with the ulnar nerve along with the adductor pollicis, and superficial branch of the ulnar nerve which is supplying flexor pollicis brevis, palmar introit, dorsal introit, third and fourth lumbricals, and for the top what you are seeing. So all these are innervated by means of the of your ulnar nerve. When you see the clinical part, the ulnar nerve gets entrapped at two common sites, one at the elbow which is called as not carpal, it is cubital tunnel syndrome. It is entrapped at that, means it can compressed at this time, which is called as cubital tunnel, or Guyon's canal which is called as ulnar tunnel syndrome. Yes, when ulnar nerve is compressed or injury to the ulnar nerve, what happens is along with the numbness and tenderness, there is ulnar clawing of the hand. There is what you can see the partial clawing of the hand. So this is what you are seeing. It is caused by the nerve lesions at C8 and T1 where metacarpal joints are hyperextended. Metacarpal joints are hyperextended and interphalangeal joints are flexed. So in this way you can see partial clawing. This is called as ulnar nerve injury result for that of a partial claw hand. So this is what you are seeing, the partial clawing of the hand where you can come across at the metacarpal part there is hyperextension, whereas at the interphalangeal joints there is flexion at the interphalangeal joints. The ulnar nerve injury causes claw hand. So this is the claw hand what you will be coming across. So this clawing is called as partial clawing involving only two ulnar digits, where ulnar nerve is in, this is called as complete claw hand because there is a complete involvement of ulnar and the median nerve which results in complete claw hand. Yes, the last slide, clinical part. So this part what you are seeing is the claw hand. It is the ulnar claw hand. Yes, complete. It might be our partial. Median nerve, ape thumb deformity is seen. There is one more nerve at the back which is radial nerve because of which wrist drop can come. So this is the drop of the class. Yes, I think many have many doubts. It might be a vast class. Yes, I don't know how much you have understood. A drop in a ocean. But if you go on through, because at this part we don't have any dissection, but if you go on through the books, anyhow it is a class in the YouTube, it can be again read and again you can hear the class again once. You can read it again then come and hear. Yes, if you have any doubts, as such we have introduced our WhatsApp numbers and there is a group. You can ask in that group. Thank you, ma'am. Good day.